So good morning, everyone. I thought I would stand rather than address you so that majority are looking at the back of my head. It gives me tremendous pleasure as a European to welcome a fellow European from Belgium to the meeting today, and also by video link. So congratulations and many thanks to IAM for organising this. Without further ado, I'd like to introduce Professor Sara Willems, who's Professor of Health Equity at Ghent University in Belgium, and she will be talking about educating health professionals to address the social determinants of health. Thank you.
Good afternoon, ladies and gentlemen, and thank you for introducing me so kindly. I'm actually at the other half of the globe. It's a warm autumn evening here in Brussels. I hope you have also very good weather there. Unfortunately, I could not be there today because of the start of our academic year. I could not travel this week, so I'm most grateful for IOM to be able to give this talk through WebEx. I'm grateful, but also very honored to be able to present to you the results of the systematic review we did on educating health professionals to address the social determinants of health. I don't know if you can see my slides. Yes? Shall I give
Yes, we can.
Each time I would like... Yes, okay,
yes,
thank you.
we can see them.
Why is this report so important? We all know that the social determinants of health are mostly responsible for health inequities. Also, some authors even indicate that the social determinants are the most important ones in explaining population health. Therefore, it's of utmost importance that future health professionals not only are educated about the medical side of health and illness, but also about the root causes of it. Therefore, we got the task to write this background paper, and the aim of this paper was to identify programs for health professional students that address the social determinants of health in and with communities. So how did we do this? We performed a systematic literature review where we did a systematic search of a wide range of databases. And in the next phase, we did a stepwise screening and analysis of the papers that we found. We did this with two independent researchers, and we discussed until we reached consensus on the in or the exclusion of papers. In order to do that, we developed a screening instrument based on the goals of this study. Next slide, please. I'm very sorry, but I can't see my slides. It should be on slide number 7. So the search of the databases revealed 297 papers, and in 2 selection rounds, we selected 33 papers as interesting for this purpose. Next slide, please. We used the following instrument to extract the data from the selected papers, and as you can see, it includes all the questions that we received from the committee, and people were asking them about the programs. Next slide, please. So in the next minutes, what I will do, I will go through the general descriptives of the programs that we identified, and then I will go more into detail on the content, concerning the content of the programs. And throughout my presentation, I will go more into detail, in the details of 3 programs that we selected for the talk of today. Yes, next, please. So first, some general descriptives. Next, please. We only found 33 papers describing training programs for health professional students that address the social determinants of health in or with the community. Of the 33 papers, 2 of them were describing the same program. So, in fact, this paper reports on 32 different programs. Next, please. The vast majority of the programs that we identified were from the US. 25 of the 32 programs came from universities based in the US. Some papers are found coming from Canadian institutions, and then one of Australia, one of Serbia, and one of Belgium, and I'm very proud it was from my home university. Yes, next please. It was very clear that most of the programs aim at medical students or nursing students, or at an interprofessional group of students, mostly including medical students and nursing students, and they are paired in those groups with students from other disciplines. And what really struck us was that in some of those programs, it is, for example, with law students, something that we don't easily expect. Yes, next, please. The programs, we found programs aiming at undergraduate students, at graduate students, but also at PhD students. And in some programs, one chose to make a mix of students from different levels in order to stimulate peer-to-peer teaching. Yes, next, please. There was a large variation in the total duration of the programs that we found. Some of the programs only last for a couple of hours, or in the best case for one day, whether in other programs they are really embedded in the entire curriculum. There was also a large diversity in the intensity of the program. Some of the programs we're talking about 1 or 2 hours a month, whether in other programs one chose to give very intense one-week courses. And I think a very good example is on the next slide, slide number 16, it's the Urban and Community Health Pathway, which is a program held at the University or the Medical College of Wisconsin in the US. And this program aims to prepare future physicians to effectively care for patients in an urban, underserved setting, to promote community health and to shape the system. This program is focusing on medical students and is a program which is a very good example of a program that is embedded in the total curriculum. So students get about 10 hours a month. They're taught about social determinants of health throughout the first 3 years of medical school. And those 10 hours is divided, in fact, in two parts. Each student has to follow 4 hours of core sessions every month. And on the next slide, you can see in this table very well how this is divided over the months and over the different years of the medical program. And you can see very clearly that each month one of the topics is addressed. Next slide, please. In this school or in this project, next to the 4 hours of core sessions, the students also have to follow 6 hours of experiential non-core activities. And these are activities students can choose themselves depending on their personal learning agenda. So these activities are different for each and every student. And university offers some of the activities, but students can also bring up new activities they think are very interesting for them. Next slide, please. Next, we will go more into detail on the content of the programs. What are these programs in fact doing? Next slide, please. First of all, we took a look at the goals of the different programs. The first set of 9 programs, they have goals which explicitly mention the social determinants of health. And for example, this the program from the University of British Columbia states that they want to foster a better understanding of social determinants of health and of ways of addressing health disparities. So this is a very clear goal addressing the social determinants of health. Next slide, please. However, there were also programs, we call them type 2, where the goals don't mention the social determinants of health, but mention other aspects that are very related to the social determinants of health. For example, health inequity or health disparities. We did include them in this report because when we looked at the contents of those projects, they were clearly on social determinants of health, and those were clearly addressed in the program. So we included them, although the social determinants of health were not mentioned as a specific goal. Next slide, please. A third type of goals, or a third type of programs we found, were programs where the social determinants of health were implicitly referred to in the goals. For example, in the summer practicum from the University of New Mexico, they say they want to enhance students' knowledge and understanding of health issues and healthcare practices in rural and underserved communities. And when we look again at the content of this program, it really addresses the social determinants of health. Next slide, please. And then finally, there was one program that was included in this study which didn't refer at all to social determinants of health or to any related issue. But still, we included it in the report because when we looked at the content, it was addressing social determinants of health. And even more, in this program, the knowledge of students about social determinants of health was even one of the outcome measures of the evaluation. So that is also a program that we included. Next slide, please. So our task was to look at programs that are really are addressing the social determinants of health and taking the students out of the classroom to do that. So the question is, where do we take them? Where do these projects or programs take the students? Next slide, please. So mostly, in most of the programs, students go to local communities. However, there's a large variation in the community agencies and the care providers they visit. Goes from domestic violence shelters, homeless shelters, but also free clinics or primary care centers. And those are all agency and providers working for very large variety of populations. Some of the programs send their students to work in low-income populations or in native communities or migrant communities. What we noticed was that remarkably a large number of programs actually is sending out their students to homeless communities or homeless shelters for homeless people. Next slide, please. A very good example, I think, in this context is a program at the University of Toronto, and they took the community very, very close to the work of the university. They took it into the clinic where the students do their residency. So this program, the Integrated Curriculum on Health of Marginalized Populations in Toronto, is focusing on their medical residents. So the medical residents go to the clinic and stay in the clinic for 1 to 4 months. And traditionally, students during their clinical residencies, they have a morning round where they see the patients, and they have evening rounds or afternoon rounds. So this specific program takes or sees the morning round as an opportunity for discussion on the root causes of health. So when the group of students, they visit a patient, they are not only looking at the clinical side of the patient's health problem, but they're asking themselves the question, what are the root causes of the health problem of this particular patient? And during the day, they're asked to collect data on that and to inform themselves, because in the afternoon, one of the topics, they call it topics, one of the health problems is picked out, and students are asked to answer 3 questions. One, how do the social determinants of health pertain to this particular topic? Secondly, how are population groups, or which population groups are at risk for this problem? And what are advocacy opportunities for physicians at the clinical or policy level? And I think this is a very nice example of a program where the social determinants of health are taken into the daily work or the daily work of the university. Next slide, please. So in most of the programs, students go out to local communities. In a few programs that we identified, students also go to communities outside of the country. Mostly they go to low-income countries where they do a social immersion, as it has been called. Yes, the next slide, please. Another thing that we looked at when we were considering the different programs was the educational approach that was used. And far out, the educational approach that has been used most by the programs that we identified is community service learning. In 16 programs, this was the educational approach. And if we count also the ones that are using community-oriented primary care, these two approaches are actually representing most, or are represented in most of the programs that we found. On the next slide, you can see I just put down the definition of community service learning for those who are not familiar with it. It's a form of community-centered experiential education that locates emerging health professionals in community-generated service projects. So it provides very structured opportunities for reflection on the broader social, economic, and political context of health. And this aspect of reflection is very important in this community service learning, and I will come back on this a bit later. Next slide, please. Reflection is very important, and therefore we took a look at the reflection opportunities that are given by the programs to the students. And in 22 of the 32 programs, indeed, reflection was was specifically mentioned as an educational approach that has been used in this program. In 8 programs, there was no information available on reflection, and there was only one program where the paper explicitly mentioned there was no reflection. I would like to present you now a project or a program at the University of Arizona, because it's a very nice example of service learning. In the University of Arizona, the master students, maternal and child health, and the master students, health behavior and health promotion, and the PhD students, they are obliged to follow one of the 5 service learning courses that the university organizes. PhD students even have to follow 2 of them, or they can choose to follow one of them and co-teach one of them. The service learning courses that are organized, they're very intensive courses. They take about 1 week, and they are focused on binational, rural, and indigenous community in the southwestern United States. Next slide, please. On the next slide, you can see the different communities in which this program takes place. It goes from urban families to indigenous families, border health, rural health, and urban metropolitan health. And as you can see on the slide, they use quite a lot of different educational methods to reach the goals, going from panel discussions to giving presentations on health issues in the communities, or participating in public health activities that are taking place in the community, like immunization. Next slide, please. Next, we took a look at the theoretical frameworks that are used in the different programs. Cultural competence was far out the most apparent theoretical framework that has been used, that was used in the programs that we identified. But also sociocultural awareness was one of the theoretical models that was used, along with some frameworks focusing on the ethical aspects and the social justice aspects of social determinants of health. On slide 34, I made an overview of how the programs were actually evaluated, because this was a particular question of the committee or of the commission to take a look at how the programs are evaluated and what is the outcome of the evaluation. And And as you can see here, 5 of the programs that we found did a qualitative evaluation of the program. 5 of them did a quantitative evaluation, and 8 used a mixed method. At the first glance, this is a good result. However, if you look deeper into the evaluation that has been taking place, what we see is that often the evaluations are of low quality. Very often, it's very low sample sizes. There is no control group because it's an intervention where all the students take part in, or there's a huge selection bias. A lot of the programs that we found are not are elective. Students can choose to participate or are elected to be part of the program. That means that it's a very selected public of students participating in some of the programs, which has an impact on the evaluation rate at the end of the program. Yes, next slide, please. So let's go to the conclusions and the recommendations. The first conclusion is that we found a very limited number of programs, and the majority of the programs we found was US-based and mostly focused on medicine or on nursing students. There was an explicit question from the Commission to look at the costs of the programs, and there was only one program reporting on the cost of the program. So there was almost no information on costs, and there was a lot of missing information in general. If we look at the descriptions, very often there was information lacking, and we had to go and look for the missing information on internet. And for some of the programs, we succeeded in finding that information. Next slide, please. So one could expect there is a clear publication bias. There are certainly other programs going on in other health professional trainings in health professionals, and there's certainly other programs in other countries. However, we don't find them if we look into the literature. So additional searches are certainly needed, I think. Secondly, I think it's important, or there is a need for a more transparent reporting on training programs, because now there's a lot of information lacking. It's impossible, almost impossible, to compare programs. So I think it would be great if we could have more transparent reporting on those training programs. Next slide, please. A second conclusion is that service-based learning is far out the most used educational approach. Next slide. If we look at the literature on service-based learning, we learn that the service-based learning has 3 important components. First of all, service-based learning must meet the real community needs, because if it doesn't, service-based learning leads to rich people getting richer, or to be precise, people who know already a lot getting more knowledge. If we take this component, or take a look at this component in the different programs, it's difficult to make a conclusion. Almost none of or very few programs report on how they really were addressing the needs of a community and how they took into account the needs of a community. In other programs, it's a bit doubtful whether they actually are addressing the needs of the community. So this is certainly something that needs to be looked at more closely. Secondly, or a second component, and as you can see on the next slide, is that service-based learning needs to grow out of intentional learning outcomes. And this was one of the things that we felt as a real problem in most of the papers that we read. In a lot of the papers, the learning outcomes for the students are not mentioned. In the best cases, there's a general aim or a general goal which is described, but the specific learning outcomes or the specific learning goals for students are not always mentioned. So this is very difficult to conclude upon. And then the third component of service-based learning is on slide number 40, and it says that service-based learning should offer structured opportunities for reflection. It's the reflection which makes the difference between service learning and going out and doing what's best. And that's the reason why we took a look at it. And I think there we found very good results. In a lot of the programs, or in 22 of the programs, we found very explicitly attempts or initiatives to have students reflecting on what they are doing and what they are seeing in the communities. A fourth conclusion on the next slide is that the evaluation of the programs are often limited to self-reported outcomes of students. As a student, do you think that you reached the learning goals? To the measurement of individual behavior, you as a student, what did you actually do? And the system approach is often lacking, although the Lancet Commission strongly emphasized the system approach, and this is something that we hardly find in any of the papers that we read. Next slide, please. So service learning experiences, they seem to be highly valued by educators, but also by students. Students find them very nice, a very nice way to learn. However, the effectiveness of it remains very unclear, and there is clearly research needed on the learning effects of service learning and on its impact on the community and the use of standardized instruments for measuring the outcomes across projects. So we can say something in general about the impact of service learning. Next slide, please. What is also important is that in the evaluation of programs, that not only the impact on individuals should be measured, and then we're talking about students, but also faculty, staff, or individual patients, but also the impact on populations, the communities, and on systems should be evaluated. And then we're talking about the impact on healthcare systems, but also on the impact on educational systems. And every now and then, in the conclusions of some of the papers, this is referred to. The authors say having this program in our faculty has changed our faculty too, and has changed our other staff members too. So this is certainly something very important to look at. To conclude, and the next slide and final slide, please, the findings of this paper were meant to feed the further work of the committee to develop a framework for how the education of health professionals regarding social determinants of health could be strengthened. And I strongly believe that this work and this review could benefit from some additional work and some additional searches for other programs. I think it would be very useful not only to look at the 33 papers that we identified, but also to use a snowball method and look into the references of those papers to look for other interesting papers. We already started that, and we found some interesting additional information. I think it's also very important to do a search on internet, because a lot of the programs are not published, but are mentioned on the websites of the universities. And for when we wrote this report, for some of the programs we found in the articles, we took a look at the information on the website, and mostly there's quite a lot of information you can find on the university websites. So that's probably very interesting. But I think it would be also very interesting to do a systematic screening in abstract books of some conferences that might be very relevant for this topic. For example, the conferences of the Network Towards Unity for Health. And then lastly, maybe it is important, or it could be very interesting to do also really research and start an intervention in some schools and see what the effects can be. So thank you for your attention, and I'm really looking forward to your feedback and to your questions.
Well, on behalf of us here in Washington, Professor Willems, thank you very, very much for an extraordinary job that you and your team have done on delivering such a report and encompassing such a broad range of data and publications. So on behalf, I think, a round of applause.